so in the previous video, we actually went through what facet syndrome is. So if you've been to the chiropractor and they've diagnosed you with this condition and you're getting treatments, you may be wondering what else can you do? And that's something that I want to kind of go through with you guys, because there are a few exercises that you could do if you suffer with this condition.
It's about getting to the root problem.
Hey everyone, it's Dr. Heather, your virtual sports chiropractor. And like I said to you in the facet syndrome video, where we kind of really go through what facet syndrome is, I actually told you I have it. Okay, so I want to go through with you guys some exercises that are going to help with this condition. So let's get started. So as you can see, I have my yoga mat out and I also have my foam roller near me. If you have a yoga block, you're going to want that as well. So the first thing we're going to do is we're going to lay on our back on the mat and we're going to be bringing our knees into the chest. So the first thing we're going to do is we're going to come down onto the ground and we're going to bring our knees into the chest. So we're going to come down nice and easy. Now instead of having the knees pressing in, I want you guys to focus on bringing the knees to flail out a little bit more. And as you can see, they're going more towards my shoulders instead of actually to my midline. So from here, I'm going to go ahead and I'm going to nice and easily just hold and kind of press the small of my back into the floor. From here, if you wanted, you could do a nice little rock side to side. You might feel a little bit of massage work along the SI joints as you do this. So just nice and easy here. Now the second exercise we're going to get to is actually a child's pose. And this one you might be more familiar with, especially if you're somebody who does yoga all the time. But this time when we do our child's pose, we're actually going to go ahead and again, we're going to splay our knees out a little bit more so we can try to stretch out our SI joints along with our lumbar spine a little differently. So I'm going to go ahead, I'm going to come to my mat just like so. And notice I bring my knees out to the side of my mat. From here, I'm going to reach and walk my arms forward as I try to sit my hips down and back, pressing my tailbone down as I go. And you're just going to hold for like a count of 5. Now the next exercise is going to involve our foam roller. And what we're going to do is we're going to practice a pelvic tilt. Because a lot of times somebody who does suffer with facet syndrome will have more of an anterior tilt to the pelvis. And if you haven't checked out my anterior tilt versus posterior tilt video, which really talks about whether or not you should be stretching the hamstrings or working on your hip flexors, do check that one out because it's going to help answer a lot of questions for you guys. But a majority of people who suffer with facet syndrome will have that anterior tilt. They have an increase in that lumbar curvature. So what we're going to do first is we're going to first get into our pelvic tilt, then we're going to utilize the foam roller to help enhance that pelvic tilt a little further, along with doing a little bit more of an advanced exercise. So the first thing we're going to do is we're going to come down onto the ground on our yoga mat. The second thing we're going to do is we're going to practice kind of creating an arch to our back and then pushing our small of our back down and in towards the floor. Place a towel underneath you so this way you could have something to mentally have a connection with. Otherwise, you could slip the hands underneath a little bit and again pressing down as if you're feeling the small of the back, squeeze and press the hands. Now once you've gone ahead and you've done that a couple of times and you understand how to do a pelvic tilt, we're going to add in our foam roller. Now granted, my foam roller is quite long. You may choose to use a shorter one for this exercise or, like I said, a yoga block. But notice I place the foam roller in between my knees. I'm going to go ahead, push the small of my back down into the floor, create that nice pelvic tilt, and I'm going to squeeze the roller. This exercise I'm going to do for about 30 seconds. Now from here, the next exercise we can go right into is a nice easy bridge. So from here, I maintain my pelvic tilt. I'm squeezing my roller with a good firm pressure onto the roller. And now nice and easily, I'm going to bring the small of my back up off the ground. Notice though that I don't go very high, nor do I hyperextend the back. So again, let's repeat. So I'm going to come down, arch my back, then press it into the ground, squeeze my roller, lift my hips off the floor in a manner just like so. And I can repeat this up to 20 times. Now the next exercise that's really great to do is what's known as dead bug, but we're going to take it in a few stages. So again, we're going to come down onto our mat and we're going to lay on our back. So now from here, I'm going to bring my knees in towards my chest so that my knee is actually at a 90-degree angle. So if you can see here, it's a nice 90-degree angle. So now from here, what we're going to do is we're just going to hold this position and see if it feels comfortable. If it does, we're going to extend first one leg straight out, just like so, maintaining and keeping the small of the back pressed into the ground, and bring the leg back in. Then you can repeat and do the same thing on the opposite side. Now, if you notice when you extend the leg, you're having some low back discomfort, then that is not the space that you're going to go to. Meaning, you'll just hold this position first, get comfortable with some core work here before advancing to the leg going out like so. Now, if you're feeling comfortable with the leg going out, you're going to add in your arms. So what would happen is, I would simply go left leg, right arm in extension, and then I would come back to position, and then I would do the opposite, and then come back into position. But again, if you're noticing some low back discomfort with doing the legs, you're just going to go ahead and hold this position for 30 seconds. Now another exercise you may be somewhat familiar with is known as bird dog. Bird dog is really great for those of us that do suffer with this condition. But again, we're going to take this one in phases because if you're noticing any low back discomfort, you're not going to want to go through all of the progressions. You're going to want to take it nice and easy and progress nice and slow. So with the bird dog position, we're going to come down on our hands and knees, and we're going to try to keep a nice flat back. Now granted, some of us may have a larger increase in curvature than others, but for most purposes, we're going to try to keep a nice flat back. From here, we're going to start with the arms first. We're going to lift the arms straight out in front and then bring it down. Again, lift the arms straight out in front and bring it down. Now, you may notice that this one might be a little harder for you, especially if you have a little bit of limitation in your upper body surrounding your shoulder blades. So again, do what you can in the best form that you can do it. The next part is to actually go opposite leg, opposite arm, and then come back to neutral. Again, opposite arm, opposite leg, and come back to neutral. And you would want to repeat that at least 10 times to each side. So there you have it. There are several exercises that you can do that are nice and simple and basic and don't require you going to a gym. You can simply do them from the beautiful outdoors, or you can do them right in your living room or bedroom at home. Now, if you found this video helpful with exercises for facet syndrome, smash the like button and don't forget to subscribe. If you have more questions regarding facet syndrome, do check out the video where we kind of go a little bit more in depth on what facet syndrome is and how to really tackle that condition. All right, everyone, I'm Dr. Heather, your virtual sports chiropractor. I'll catch you in the next video.